where a person's physical appearance and abilities are frequently judged. In some cases, it refuses to accept someone who looks, walks, or even speaks differently than they do, and consider themselves superior to those with disabilities. However, part of it has also demonstrated positive deeds to help those people with disabilities. In fact, through their help, there are various people throughout history who have shown that their physical limitations or disabilities were not strong enough to shatter their willpower. This is Jizame M. Budyungan, a BSed Social Studies 2 student, and together with my team, we are going to spread awareness about severe and multiple disabilities. And for the first part of our presentation, let's hear from Mr. Melvin Loren.
So hi guys, I am Melvin Loren from Group 7, and today I'll be discussing the definition of severe and multiple disabilities. So before that, I will divide first the definition of severe and multiple disabilities. So first, severe disabilities. So severe disabilities. Persons with severe disabilities are those individuals of all ages who require extensive ongoing support in more than one major life activity in order to participate in integrated community settings and to enjoy a quality of life that is available to citizens with fewer or no disabilities. So meaning, severe disabilities are those people who are suffering either cognitive, either it has a syndrome, a mental, and sensory disabled. For example, deaf, blind, or people who had a cerebral palsy. They are individuals who require support in order to enjoy quality of life just like the normal person with no disabilities. So those individuals who has a Tourette syndrome or pagkabuta or bungol, pagka-mute or amang, mental retardation is also regarded as a characteristic common to those with severe disabilities. So mental retardation meaning pagkaalantala. So most severely disabled individuals are limited in their ability to communicate. Maglisod ng istorya. Though these skills can become functional with appropriate intervention. In addition, these individuals often have medical conditions or physical limitations that affect their movement, vision, or hearing. For example, an individual has a cerebral palsy. We know that in cerebral palsy, ang isa ka individual is either maglisod siya o lihok tungod yang kahimtang. Probably napiktuhan ilang paglihok, pagdungog o ilahang pananaw. So, by their disabilities, their chance of moving and senses are also was limited. Example, Amelia is 8 years old and in 3rd grade. Her diagnosis includes a disorder where the tissue connecting the two halves of her brain is damaged. She also has a diagnosis of global development delays. She is non-verbal and communicate entirely by gestures or ang paglihok. She is able to handle classroom tools but struggles to use them appropriately. So, people like Amelia requires ongoing extensive support in more than one major life activity in order to participate in integrated community settings and enjoy the quality of life available to people. So people like Amelia, need nila ang support so that she will also feel the feeling of being a normal child. Ang mga enjoyment nga naa sa mga normal nga mga tao is deserve pod sa mga tao nga na ay severe disabilities. So here are some examples of severe disabilities in one or more of the following areas. So first, adaptive behavior. These are things that mostly we see to children. Probably difficulty of avoiding danger, difficulty of self-awareness, in short, just like the typical characteristic of babies. Kaning adaptive behavior is makita ni nato sa mga Kana bitang nangigdad na nga mga tao pero agi lang hunahuna is isip bata pagyapon. Sometimes we see people like individual like that nga bisag taas na og edad pero bata pa ang pagunahuna, maglisod og suot og sinina or sa pa ba, maglisod og suot og sapatos, just like that. So next is hearing impairment or the difficulty to hear. Na. Visual impairment, difficulty to see or total blindness. And fourth is the health impairment. Example of health impairment is the Tourette syndrome, or another example is epilepsy. So those are the definition of the severe disabilities. Again, severe disabilities has those individuals who require support in order to participate in integrated community settings and to enjoy the quality of life that is available with those persons has no disabilities. Next is multiple disabilities. So persons with multiple disabilities have a combination of two or more serious disabilities, just like cognitive, movement, and sensory, such as mental retardation with cerebral palsy. So, ang multiple disabilities, from the word itself, multiple, it has a two or more serious disabilities. So, according to the Individuals with Disabilities Education Acts or IDEA, multiple disabilities means concomitant impairments such as mental retardation, blindness, mental retardation, orthopedic impairment. So, the combination of which causes such severe educational needs that they cannot be accommodated in special education programs solely for one of the impairments. So, when we say concomitant, these are impairments that are simultaneous. And when we say simultaneous, it is happening at the same time. So, this impairment includes intellectual disability, blindness, and many more. Let us bear in mind that multiple disabilities aren't all the same. The term multiple disabilities is general and broad. For the term, you can tell that how many disabilities a children has. Kay sa meaning sa multiple disabilities, two or more serious disabilities. So we cannot tell how many disabilities a children has. So next is which disabilities are involved or how severe each disability has. So for example, a child may have difficulties in learning along with controlling her movements and or with hearing vision. The effect of multiple disability can be more than the combination of two individual disabilities. A child who is multiple disabled should receive help and as early as possible so that she can be helped to achieve her potential. And so that their disabilities will not become worse. We must try our best to assess children's understanding and expression to ensure that she is not wrongly labeled. So here are some examples of multiple disabilities. 1. Deaf blind. Visual impairment plus hearing impairment. Pasabot nga duha man ka impairment, this is an example of multiple disabilities. So ikaduha, visual impairment plus hearing impairment plus mental retardation. Visual impairment mo tong di makakita or sabing blind. Hearing impairment, either probably it has difficulty of sense of hearing, and mental retardation or pagkaalantala. Third is visual impairment plus mental retardation. And last is cerebral palsy plus mental retardation, hearing, speech, or visual problems. So cerebral palsy, as I have said, children who had a deformation of their parts of their body, and hearing and speech or visual problems. Difficulty to hear and difficulty to see. So again, multiple disabilities is a combination of two or more disabilities. That's all in my part. So guys, thank you.
Now, we already know what is severe and multiple disabilities. Thank you to Mr. Loren. And you might ask, what are its causes and characteristics? So for further information, please continue watching as I share to you the causes and characteristics of severe and multiple disabilities. The causes of severe and multiple disabilities. So we already know that severe and multiple disabilities have distinction, and often its causes are unknown. However, in some children, it is known, and here are the most common causes of severe and multiple disabilities. So first, chromosome abnormalities, premature birth, difficulties during or after birth, poor development of the brain or spinal cord, infections, genetic disorders, and injuries from accidents. So one by one, we will talk about it, and let's start from chromosome abnormalities. So chromosome abnormalities are the result from mutation, which it has two types, which is the numerical abnormalities and the structural abnormalities. So the numerical abnormalities refers to the change in the number of chromosomes, and the structural abnormalities, obviously, it is the change in the structure of chromosomes, and both of them may alter the ability of the cell to survive, or if it will survive, it will alter the ability of the cell to function. So next is the premature birth. So premature birth is also known as a preterm birth. Is when it happened when a baby is born too early, specifically before 37 weeks of pregnancy. Then the earlier the baby is born, the higher the risk of death, or if makasurvive, serious disability. Next, number 3, difficulties during or after birth. So we all know that each pregnancy and delivery is different, and problems may arise. Some of the common complications are perennial tears, abnormal heart rate of the baby, or early water breaking, and many others. So these difficulties, if experienced by a mother who is giving birth, then it will directly affect to her baby. Next, the poor development of the brain or spinal cord. So the brain and spinal cord of a growing fetus developed from a simple structure called the neural tube. So poor development in it may cause disabilities to the child. So one of it is the neural tube defect. So this will directly affect the baby. So however, taking the right amount of folate before and during early pregnancy can prevent 7 out of 10 cases of neural tube defect. So actually, this neural tube defect has many types, and if taking the right amount of folate will be done, then 7 out of 10 cases of neural tube defects will be prevented. Next, number 5, infections. So infections appears to be a prominent cause of chronic development impairment in children according to the global data. So this meningitis, measles, and congenital rubella are the most common causes of hearing impairment, and then the most often researched disability, according to a comprehensive analysis of childhood disability in poor and middle-income countries. Infections are also a common cause of various types of impairments, such as intellectual impairment. And next is the genetic disorders. So genetic disorders are the change in the DNA sequence away from the normal sequence. And lastly, the injuries from accidents. So we'll know that an injury is the damage to a child's body. It is a general term that refers to a harm caused by accidents, falls, hits, weapons, and more. So, for example, a child may bump his head into a table and it results to bleeding. So we don't know if that accident will affect the child in the future. It may affect how he perceives the world, how he think, or we don't know. So these 7 causes are the causes of severe and multiple disabilities. And whatever the reason or the cause of that severe and multiple disabilities, still it will result to a disability. And fortunately, there's help available for those children with severe and multiple disabilities, and you will know later about that. Next is the characteristics of severe and multiple disabilities. So the characteristic of severe and multiple disabilities depends on the combination and degree of disabilities as well as the person's age. And people with severe or multiple disabilities may exhibit wide range of traits. However, they share some characteristics, so such as the vision problems, limited speech or communication, difficulty in basic physical mobility, tendency to forget skills through disuse, trouble in generalizing skills from one situation to another, and or a need for support in major life activities such as domestic, leisure, community use, or vocational. And last 2, medical conditions and odd behavior. So one by one, we will tackle about it. So first, let's talk about vision problems. So as an example, you might see children with severe and multiple disabilities to always squeeze their eyes in order for them to see things clearly, and also they always bump into things because of their vision problems. And most of them have different eyes than others. Next is the limited speech or communication. So communication is probably one area that is most significantly affected in children with severe and multiple disabilities. So because of their disability, they were not able to express themselves. They were not able to talk, or sometimes we can't understand what they are talking or what they are expressing. Next is the difficulty in basic physical mobility. So since because of their disability, they are restricted, or they can't execute some of the skills or actions that a normal people does. So we all know that our sight, hearing, and body movements help us to move around without bumping into things, or to remember the way to reach places, or even to use our hands to hold and look at things. So the presence of cerebral palsy, locomotor, or other disabilities makes it hard for those children to manage his or her own body movement sometimes, and so it becomes very difficult to use his body to move from one place to another. So because of that disability, they are not able to execute some of the movements or skills that are teach them. Next is tendency to forget skills through their use. So because of their disability, it is hard for them to execute the skills on a daily basis, or to execute it sometimes, and it will result for them to forget the skills they acquired. So next is the trouble in generalizing skills from one situation to another. So due to the combined loss of two or more disabilities, the rate and speed of learning of children is very low. So learning often becomes repetitive and meaningless unless special care is taken to make the child feel safe about exploring the world around him. Example, the multi-handicapped children has a very limited ideas to play with toys or things around them. So they need people to help them. Next is a need for support in major life activities such as domestic, leisure, community use, and vocational. So, of course, since they are not able to do things properly, to move their body, to learn things, they need assistance from other people. Next is the medical condition. So most children with severe and multiple disabilities suffered from other medical conditions such as epilepsy, frequent eye and ear infections, respiratory surgeries, or respiratory disorders, muscular degeneration, and frequent surgeries, and so on. So such medical conditions lead to frequent hospitalization, and the child again misses out a lot of exposure and learning from the environment. And lastly, the add behavior. So most of children with multiple disabilities show strange behaviors that are called self-stimulating. Some of these are the moving one's body repeatedly, moving their head from side to side, and many others. So sometimes they do this due to the lack of knowledge, and also sometimes it is important for them to continue doing it from time to time as it helps them get some information about the world they are in. And sometimes also these children show disturbed sleep patterns. So they really needs help from professionals, from parents, and also care from other people. And these are the characteristics of severe and multiple disabilities. And for the medical implications or procedures and assessment used to diagnose severe and multiple disabilities, let us hear from Ms. Mary Joy Fernandez.
So now we will discuss medical implications of severe and multiple disabilities. But before that, let me define first implications. According to Merriam Dictionary, implications defined as the fact or state of being involved in or connected to something without being said directly. Therefore, if we connect implications to medical, it's explicitly discerned that medical implications is a variety of medical problems that may accompany severe and multiple disabilities. Examples include seizures, cerebral palsy, sensory loss, hydrocephalus, and scoliosis. These conditions should be considered when establishing services. A multidisciplinary team consisting of the students' parents, educational specialists, and medical specialists in the areas in which the individual demonstrates problems should work together to plan and coordinate necessary services. However, many disabilities impact activities of daily living. Possible disabilities that can be comorbid include visual impairment, hearing impairment, orthopedic impairment, autism, and speech-language impairment. From the word variety, being different or diverse, that those medical problems, a variety of medical problems just like seizures, cerebral palsy, the sensory loss, and many to mention, can possibly accompany or lead severe disabilities, including adaptive behavior, hearing impairment, visual impairment, and health impairment. So if we were going to establish or substantiate services, we should consider the following different medical problems in order for us to be aware. Likely, the students, parents, educational specialists, and medical specialists are definitely involved to uphold a plan and coordinate for a quick response of these services, which is we identify it as a severe disabilities. We will proceed to the procedures and assessment measures used to diagnose severe and multiple disabilities. Procedures and assessment measures used to diagnose multiple disabilities. A student with multiple disabilities shall be evaluated by the procedures for each disability and shall meet the standards for two or more disabilities. If a student is suspected of having multiple disabilities, the following evaluation should be considered. So those students who have multiple disabilities needed to be evaluated by the following procedures. First, an observation by a team member other than the student's general education teacher of the student's academic performance in a general classroom setting, or in the case of a student less than school age or out of school, an observation by a team member conducted in an age-appropriate environment. So, it means that a team member will conduct an observation of the student's academic performance in a classroom setting, while those out of school youth, the observation will be conducted on the exact environment. Second, a developmental history if needed. Developmental history, also called family history, wherein inspecting or tracing back information obtained from the parents about potentially significant historical milestone and events that might have a bearing on the child's current difficulties. Third, an assessment of intellectual ability. Having an assessment about intellectual ability should also be considered, as intellectual ability defined as the exceptional capability or potential recognized through cognitive processes. For instance, it measures your memory, reasoning, rate of learning, spatial, and etc. Fourth, other assessments of the characteristics of speech and language impairments if the student exhibits impairments in any one or more of the following areas: the cognition, fine motor, perceptual motor, communication, social or emotional, perception or memory. These assessments shall be completed by specialists knowledgeable in the specific characteristics being assessed. Moreover, if ever a student exhibits impairments in any one of the following areas, such as cognition, fine motor, perceptual motor, communication, social or emotional, perception or memory, they will undergo several assessments on the characteristics of speech and language impairments. Fifth, a review of cumulative records, previous individualized education programs, or individualized family service plans and teacher-collected work samples. A sort of collecting data or information on your education, family plans, and your work that was collected by your instructor for a review of the student's record. Sixth, if deemed necessary, a medical statement or health assessment statement indicating whether there are any physical factors that may be affecting the student's educational performance. Likely, in any case, they will acquire students' medical statement that will indicate whether there are physical factors that possibly affect student educational performance. Seventh, assessments to determine the impact of the suspected disability. First, when the student's educational performance when the student is at the age of eligibility for kindergarten through age 21. I know that you already understand it. So, second, on the student's developmental progress when the student is age 3 through the age of eligibility for kindergarten. And last, And last, procedures and assessment measures used to diagnose multiple disabilities, additional evaluations for assessments necessary to identify the student's educational needs. So there are additional evaluations in order to identify the student's educational needs. As we all know, every students have different needs in terms of education.
Thank you, Ms. Fernandez. Finally, we're down to the last part of our presentation, which is the educational implications and intervention for severe and multiple disabilities, to be given to us by Ms. Jane Sopiesa.
Implications of educational legislation. In the past, students with severe and multiple disabilities were routinely excluded from public schools. The legislation in the early 1970s addressed the right to education and other rehabilitation services for all individuals with disabilities. In 1975, the Public Law 94-142, or the Education for All Handicapped Children Act, or ECA, now called the Individuals with Disabilities Education Act, or IDEA, formed the legal basis for public education for all children, including those with severe and multiple disabilities. IDEA added requirements that are especially valuable for these individuals, including early intervention starting at birth or whenever a disability is suspected. So, early intervention is crucial, and it is so important for the child's development in physical, in mental, and in emotional aspects. Also with in dealing social environments such as in school and in the community. The earlier the intervention, the better the outcome. Related services such as physical, occupation, and speech and language therapy, including augmentative and alternative communication methods. So AAC methods include text-to-speech technologies, the use of images, and sign languages. The requirement for a plan and services to facilitate transition to work and adulthood, and a value placed on inclusion in general education with non-disabled peers. So of course, it is valuable in a sense that people with such disabilities will feel the belongingness and not isolated. Most states provide services to these students until age 22 or beyond, focusing upon functional skill development. So in order to be effective, educational programs should assess needs in four major areas. First is domestic. So learning basic skills that is part of everyday routine like cooking, doing laundry, and even doing self-care. Second, leisure or recreational, community and vocational domains. These assessments enable the identification of functional objectives, which will result in the learner's increased skills and independence in dealing with routine activities of his or her life. So the instruction should include expression of choice. So the students were taught to make choices. Next, communication. So the facilitators or the teachers will communicate the disabled person in functional ways using AAC method, or katong mag-use sila kanang kanang images, kanang sign languages para sa mga deaf, o katong text to speech technologies for those who are diagnosed with dyslexia or katong having the difficulties in reading and comprehension of words. Functional skill development. Develop useful skills that reduce their dependence on others. And lastly is age-appropriate social skills training. So this training helps those disabled person to learn social skills suited to their age. Frequently, classroom arrangements must take into consideration students' needs for medications, special diets, or special equipment. Adaptive aids and equipment enable students to increase their range of functioning. Aids include wheelchairs, typewriters, headsticks, headgear, clamps, modified handles and cups and silverware, and communication boards. Computerized communication equipment and specially built vocational equipment also play important roles in adapting working environments for people with serious movement limitations. So these special equipments will help those people with such disabilities to somehow provide assistance in having the ability to function without merely depending on others and to cope on their own and to live normal despite sa ilang kakuwangan or sa katong ilang disabilities. Integration with non-disabled peers is another important component of the educational setting. Attending the same school and participating in the same activities as their non-disabled peers are crucial to the development of social skills and friendships for people with severe disabilities. Integration also benefits non-disabled peers and professionals through positive attitude change. So, to integrate with non-disabled peers, it develops positive attitude in which it eliminates the barriers in participating in every aspect of life when in accordance to their desires and their abilities kay able sila nga mo share sa ilahang talent o abilities and naiubang disabled person nga skilled kaadto like hana sila mo draw mo paint and makaya nila ang makaya pud buhaton sa mga non-disabled person. By integrating one another, it can bring positive impact sa panglantaw sa life sa katong resulting to the development of an individual. So I guess that ends our video discussion about severe and multiple disabilities. So thank you and God bless.